Hello, and welcome to this UCL Connect event, Aging Well. My name is Lisa Yasamides, and I work in the Alumni Relations team at UCL. I'm very excited to be a part of this event. I'm really looking forward to hearing from our guest speakers today. If we could have the slides, please. Lovely. So for those of you who are new to the UCL Connect series, this event is part of the series which looks at improving the professional and personal development skills and expertise of alumni and students across the global UCL community. So whatever stage of life you're in, the UCL Connect series should have something for everybody. Next slide, please. On the screen are some examples of a few of the previous sessions we've run. And if you'd like to rewatch any of these, please do follow the URL listed at the bottom of the screen. As you can see, the program is a mixture of virtual and in-person events, and they are run around once a month during term time. Next slide, please. So before we begin, just a little bit of housekeeping. I want to let everybody know this event is being recorded. So there will be an opportunity to ask questions to the panel, and you can do this by using the Q&A function, and which you should see at the bottom of your screen. So please put your questions in here at any point during the sessions, and we will do our best to answer as many of them as we can. For those of you who are not aware, there is an option as well to bring up live captions on your screen. So these need to be individually turned on. If you would like to use this feature, you will see a button that has 3 dots and the word more at the bottom of your screen. If you click that button, then click captions, followed by the option that says show captions, and that will enable the feature for you. Next slide, thank you. So on the screen is what to expect from today's session. We will begin with some introductions, followed by the panel discussion, and then we'll have some questions as well throughout. So what's on the agenda for today's session? Well, I'm very welcome to introduce our chair, Dr. Brian Beach, who will be joined by Nancy Best, Dr. Fung Lung, and Rebecca Lyons and Dr. Marcus Rani. So thank you all for joining us. It's wonderful to have you back here at UCL with us, albeit virtually. And I will now hand over to you, Brian, to begin the session.
Great, thanks, Lisa. And for attendees, I see people are noting they can't access chat, but you can use that Q&A option to give us questions as we go through, because we do want this to be interactive and we want to ensure that you get the most out of this as you can. By way of introduction for myself, so I'm Dr. Brian Beach. I am a senior research fellow in social policy and gerontology at UCL. I'm also a research specialist at Karolinska Institutet in Stockholm, and I've worked at the intersection of policy, advocacy, and research on aging for 19 years now, and I'm very happy myself to be part of the English longitudinal study of aging research team at ELSA, or at UCL. And ELSA is a longitudinal study that's been going on for 20 some years, over 20 years, collecting rich amounts of data on older people and enabling quite a variety of analyses to be done to improve our understanding on the complex dynamics related to aging. So I have a lot of information that I can share, but we are not here to hear me prattle on all day. So what I'd like to do by way of introducing the panelists to everyone is to go through and just have each panelist briefly introduce themselves and highlight the one thing that they deal with or face most frequently in their lives or in their work that serves to support aging. We'll start with that, and then over the course of the hour, we want to ensure that we address aspects of understanding how to support aging well. How does aging well differ from some of the other buzzwords you might hear, like longevity or healthy aging? How do we understand the barriers and challenges that exist for people to age well or to support aging well, as in connection to that, understanding the role that various inequalities and places and social determinants have on shaping all of this. So first, let me turn to Nancy. Nancy, why don't you just give a little bit of information about your work? And I think you have quite a direct business in aging well. So yeah, share and tell what you think is the biggest thing you're facing in supporting aging well.
Thank you so much, Brian, and thanks everyone for being here. It's really nice to be back. I am obviously an alumni of UCL, so very exciting to be here. I am a qualified personal trainer and the founder of a company called Ladies Who Crunch, which is, surprise, surprise, connected to exercise, which is the big topic that I am excited to talk about today. My background is in strength training, which we'll come on to discuss in more detail in terms of how that relates to the topic and why I'm so passionate about it. But just to share a bit more about my business. So I'm really focused obviously on female health, but a lot of these learnings I think are applicable, to both men and women. And I've worked with a lot of big companies, businesses like Google, Amazon, to share my perspective and my evidence-based approach to employee well-being. So really excited to be here and hopefully give some practical and applied learnings, from my career, because whilst I'm not a scientist, I do spend my day working with real people at all sort of cycles and stages of life.
That's great. And of course, aging affects everyone, not just researchers. Fuang, let me go over to you, and why don't you share with the group where your perspective? We've just heard that we've got some expertise around exercise. Why don't you share where you're coming from and what you think you face most in terms of supporting aging well? You're on mute. Yeah.
Thank you, Brian. First of all, I feel very honored to be invited to join you all today to share my knowledge and experience with you in aging well in later life. So my name is Phuong Luong. I'm a senior research fellow at the Division of Psychiatry, University College London. My background is in psychiatry. I'm a founder of the individual cognitive stimulation therapy in dementia training and consultancy. I'm also a co-founder of the Honor of Wellness Room in Southeast London, which provide chiropractic care and other holistic therapies to the community, which to aiming to improve health and well-being. So my research is mainly focused on cognitive and psychosocial intervention, aiming to enhance the quality of life and health and well-being of people with dementia and their carer. So a little bit in content, our research look at identify the risk factor and the good factor with the impact on on people with dementia and their carer, but also it on aging well in later life. And I would like to share some of my knowledge and experience, and then hand it back to Brian.
That's great. Yes, and hopefully the panelists or the attendees can see in the panel where we've got sort of business and community engagement expertise. We've also got clinical experience here going on and talking about brain health and interventions there. Rebecca, why don't you share with the group your perspective and where you're coming from?
Thanks so much, and thank you for having me here as part of this conversation. My name is Rebecca Lyons. I am a current student at UCL doing public health. I'm currently doing my leadership and management module, so I thought this might be a good opportunity to develop my communication skills and join as part of this panel today. So thank you for having me here. I currently work at the Centre for Aging Better. So we're part of the What Works network and thinking about tackling inequalities in aging. And I'm currently working on some projects in the work team. So thinking about access to work for people in their 50s, 60s and beyond. And I have kind of background more in places. So thinking about localities, I was formerly working as part of the UK network of age-friendly communities. So working with local authorities and helping them to think about how they can ensure that more people are aging well in their place, and really thinking about how we we can tackle those barriers that many people face to having a good later life. Before that, I was working as part of Greater Manchester Combined Authority, working as part of their ageing hub. So again, thinking about how we can tackle some of those barriers, but how we can be thinking about the opportunities and challenges that are presented by ageing populations. And one thing that I'm really interested and passionate about is ensuring lived experience is really at the heart of how we come to find solutions or think differently about how our services and policies and practices and how our places look, given that we have an ageing population which is looking increasingly different than how it did when these services were set up initially in lots of cases. Thank you.
Great. So again, we're sort of extending the source of perspective that we've got here on the panel with Rebecca's coming from the third sector and understanding more about the sort of role that research plays in policy and how to shape, improve services and policies, and so a very applied aspect of aging and understanding aging well. And finally, but not least, we've got Marcus on the line. Marcus, it would be great if you could briefly introduce yourself and your perspective to the audience, and tell us maybe one thing that the thing that you deal with or face most in your work related to supporting aging well.
Lovely to be here with all of you, signing in from a slightly warmer Mumbai than I imagine where some of you might be. I'm a double alum in many ways. I have my first degree in physiology and then medicine from UCL. But my journey for aging well began 42 years ago at UCL because that's where I was born. So I'm very happy to be coming back here and talking about aging well because certainly I am aging well so far. I'm a clinician, physician. I've been in India now for 14 years. I set up one of the country's first longevity clinics, and I'm the founder and chief medical officer of Human Edge. I spend the majority of my time, as I'm sure we'll probably dive into during this conversation, working with two populations. One are individuals who are looking to age well. And for us in India, because we are demographically a younger country than Western counterparts, that does begin with people in their mid-30s. But we ironically see a lot more disease because of our lifestyle-related metabolic health explosions that we're seeing here. The second group of individuals that I work with, and that's why I'm dressed like this today as well, is with high-performance sports athletes, working with Olympians, cricketers, pickleball players, footballers, swimmers, etc., in trying to push their longevity on the sports field and in the sports arena to try and maximize their high performance and time they have in their sports as well. So thanks for having me, everyone.
Great. So again, we're seeing some of this intersection from clinical perspectives with applications to the broader world, and bringing in some of the sort of economic elements here. Marcus, I'll come to you now because I think it would be good for us to start by addressing, how we interpret or how we handle differences in understanding of words like longevity or aging well or healthy aging. So why don't you share a little bit of your perspective on that?
I'm actually very happy that this conversation was called Aging Well. I think given the vast amount of social media exposure that everyone has today and a few influencers in different parts of the world, this word longevity has somehow become confused between those who are trying to live forever or don't die. I won't name any names here, but people who are trying to don't die, versus I think where most of us, or all of us probably on the panel, are focusing our efforts on, which is the understanding of the finite nature of human life, but how do we ensure that the health span, the healthiness component of that is maximized for as long as possible. There was a fascinating paper that was released recently, I think it was in Nature about 3-4 weeks ago, looking at this longevity, escape velocity, and the great progress that we've made globally since 1960, 2019, where we've added about 19 years of average life expectancy to the world, much of it because of the alleviation of poverty in India, China, better surgical techniques, and the more widespread dissemination of antibiotics and drugs for non-communicable diseases. But if we expect or think that we're going to continue on that trend of adding 1 year for every 3 years that we live, unless there's some major biological breakthrough, that's unlikely to happen. And I think the conversation for folks like us is we have an aging demographic, we have lifestyle pressures, there is an increasing awareness about health because of the pandemic, and financial pressures because of the inability to pay for the cost of sick care. How do we as clinicians, as economists, as researchers, etc., build a framework which is financially sound and as the human being at the center to improve health?
And that's it, that you've identified the very important distinction between understanding adding years to life and adding health to life. And we certainly see this, for example, if you just look at a British context, you see extensive variation across Britain in terms of gaps in healthy life expectancy based on socioeconomic status, based on region or place. Rebecca, do you have any, from your work related to understanding places, do you have any further comments on recognizing differences between longevity and aging well and healthy aging in these various terms?
Yeah, absolutely. And thank you, Marcus. I think it's something that's really very, very interesting when people think of aging well and can often jump to thinking about lifestyle factors when actually the environments in which we live in have such a huge part to play in our ability to be able to age well. Places can be enablers, they can make things easier to be able to do, but they can also present huge barriers and can mean the difference between people being able to have a good life or not, depending on where they are. So when thinking about this place-based approach, we can be thinking about the built and the social environments. And that's something that in my work supporting the UK network of age-friendly communities, which I was for a few years, which is promotes a framework that was established by the World Health Organization. We were really keen to kind of share with places how they might apply this lens and kind of think more in the round about the different domains that can have an impact. So if you're living in a place where you can't easily go out and meet your friends, if you live in a place where you can't get to the gym, you can't get to the doctors, where you're experiencing ageism in the workplace, that's going to have a huge impact on how you're able to kind of go and have a good later life. So what I'd be often thinking or sharing when I was working with local authorities was, firstly start to have a look at the data, like what do you know about the place, or what do you know about the population that you're serving? Because chances are people are making assumptions about their populations when actually it can be so much more diverse, and the need can be very different, and the preferences can be very different too. And so that would lead into the second stage, which is thinking about how you can bring diverse voices around the place that you're looking to make good, and making age friendly, really trying to hear, okay, so what is it about the transport here that's working well? What is it that's not working so well? And how can we respond to that so more people will have a better chance of being able to have a good later life there? And it's obviously fantastic that more places are taking this approach, and that there are networks now that exist kind of within the UK and globally where people are sharing good practice around what that can look like. And it might be something like getting benches in the right places. It might be something like aging well ambassadors, so working with people who are 50 and over to have them to share and disseminate public health messages, to be taking the reins on community reporting, or businesses getting involved and doing a kind of take a seat campaign where places are offering, someone to take a seat and catch their breath without having to buy anything. All of these things make a huge difference in how people feel and experience aging in a place. And I think it's incredibly important to think about as part of that broader conversation, on top of lifestyle factors.
Yeah, that's a really important point I often underscore in these conversations, and in particular when I teach to students about aging, that the role of the social environment has a huge impact on one's trajectory with respect to aging and health. In fact, I mean, if we are now in the middle of the UN decade for healthy aging, and that definition that's adopted by the WHO for healthy aging recognizes that healthy aging can occur when people have illness. Healthy aging isn't about avoiding illness completely. It's about ensuring that the aging or any condition doesn't become impairing or enabling. And that's really the role of the social environment really creates that enablement or impairment. Fong, let me turn to you because you work with a very particular subgroup of the older population who are who do have a diagnosable condition, dementia, but nonetheless, your work is ensuring quality of life and aging well. So why don't you tell us a little bit more about your perspective on understanding, the living longer and the aging well ideas in that respect?
Thank you so much, Marcus and Rebecca and Brian. You have touched so many areas, which I'm going to say. So it seems like I run out of topic. Never mind. It's still got a few areas I would like to cover. So we talk about health as we get older. We have a chronic health condition, and then we have mobility. So I go in depth a little bit mobility, that it does affect the older people or people with dementia out and about. And that is really leading to social isolation or loneliness. And the social isolation is there. We will also look at the social network because the person gets older or they start to retire. So their social network, it gets smaller. And then the loss of their loved one, a family, relocation, and then it's, maybe it's, like neighbors, it's changing as well. That is leading to social isolation. And social isolation is different with social loneliness, because that is going to do with emotion. Your social isolation is not mean your social loneliness. So that is the area of the emotion support. It go into it. So that is, a two factor. It does affect older people when they already have cognitive decline. And when cognitive decline and you don't have people contact with you, and then if you lose the communication connect between the community and the people around you. And it's another thing we look at, because we also look at the finance already. Marcus talked about that, but we also need to look at ageism, because some people, even at the age of retirement, they still at work. And then ageism, it discriminates, that it have a great impact, a negative impact on their well-being. And this kind of well-being, it makes them lose self-confidence, self-esteem, motivation. That is also, it connects with other issue of health condition. So that is the area we need to understand. When we understand the risk factor, and then we start to look for solution. So that is, I think we need to look at. Also, go a little bit further, because in dementia or older people, when they need care, that is road chain. The road chain doesn't mean it leading to caregiving relationship also is being infected. So when it's the I think I go a little bit further than that, but it's very important, because care relationship can impact on the quality of life for an individual, as well as the carer, and as well as the community. So how are we going to help carer to reduce burden, how to help them to understand coping strategies, so that it can impact on their well-being. So overall, go back to Rebecca, policy. policy maker have to be updated with all the changes, all the research, and it need to be updated constantly. And all the research need to implement, because my experience, when we finish the research, we move on to another project. So that's why my leaders is advise me for get to the community, deliver individual cognitive stimulation therapies. No one know it. And it's such a benefit of the provide the environment for people with dementia and carer, do something together meaningfully and improve the relationship between the person with dementia and their carer from the patient perspective. That's very important. If the relationship is maintained healthy, the carer can be stay in the community, continue provide care for the person with dementia, and save a lot funding on drug, because they don't need to take any more drug. And also is helping the carer to improve their health and well-being. So that is really important. We need to look a little bit broader than the healthy, other aspect of aging well. So I think I might stop here and let other people to share. If there anything, I can jump in.
Well,
Thank you very much.
You've tapped into a very important concept that comes from life course theory, the concept of linked lives, and similar to what Rebecca was saying about the role that the built environment has on shaping aging, so do the lives that we are connected to in our own lives, and therefore the social connections. You also mentioned earlier there the importance of mobility and how mobility impacts social relations and loneliness. And so, Nancy, I want to turn to you because your organization is really, is on the forefront, you could say, about trying to prevent mobility deterioration or mobility problems, right?
Yeah, absolutely. Thank you. I was nodding emphatically, Fong, as you were talking. Look, I'm hoping on this webinar, it's not a shock for people to hear that exercise has got a fundamental role to play in your aging experience. But I think what's really interesting to draw people's attention to is the types of exercise that have the biggest impact for your longevity and your biological clock. And there's two specific kind of types of exercise I wanted to talk about today. There was actually a piece of research released this week, which looked at running. And the great news is if you're a keen runner, if you do about 150 minutes of running a week, it can kind of reduce your biological clock by up to 9 years. That's great if you love running, but that's quite a lot of exercise for most people to be doing. And it also relies on a certain level of fitness and kind of joint strength, etc., to be able to do that consistently throughout your life. What obviously I'm particularly biased towards, but is also really impactful that I think often gets missed in the conversation is strength training. And in comparison to 150 minutes a week, the research shows that only 90 minutes of strength training a week can again reduce your biological aging process by up to 4 years. Now, that is quite a stark contrast in terms of time investment. And I think when it comes to challenges for people, our lives are full, staying consistent and, maintaining some form of habit with exercise can be a huge barrier to people. So I think it's really powerful to understand what the data actually shows on, what has got the best almost bang for buck when it comes to improving your longevity, living well. And of course, mobility is sort of literal and physical, right? So mobility comes back to the point I think you're making, Fong, which is, when people don't have confidence to live a full life as they age, that can keep them indoors. But it's also literal mobility. So improving your range of motion, and something, which I'm sure will come up perhaps later in the conversation, is the risk of osteoporosis, which perhaps, I don't know, Brian, if you want to touch on that now or... But for those of you, who may not be familiar with this condition, it's a skeletal disorder, and it's basically related to the deterioration of your bone tissue. And as we age, our risk of developing this condition can increase, particularly for women, because there's a hormone, estrogen, which is really connected to maintaining your bone density, your bone mass, and that really obviously declines in menopause, and that can really exacerbate those risks. So women maintaining a regular strength program using resistance is so powerful to mitigating those risks. And when it comes to things like breaking bones, having falls, hips, knees, ankles, these are really common issues that can really affect people's mobility and confidence later in life. So, it sort of becomes a cycle where you don't have that baseline strength and your physical well-being, and therefore you don't feel confident going into spaces and places that can support you and build a sense of community.
And I'm just sort of curious, I'm thinking about the work you do, Nancy, if you have comments either related to the role that sort of the service you provide, if that's how you would say it, plays in stimulating social connections, reducing risk of loneliness, perhaps, let's say. And also, I mean, there are very, I think, to me, identifiable reasons why you focus on women and exercise for women. But could you perhaps comment about any, the differences or things that have to be taken into consideration when you're addressing a women's group versus a male group or a mixed group?
Absolutely. I think, for any women listening to this, they will resonate with the negativity around the aging process for women, which is, again, a huge societal issue that I feel we could have a separate webinar about perhaps next week. But, women in the current demographic that I work with women of all ages, and particularly women perhaps 40, 50, 60 plus. They have grown up in an era of diet culture and fear around weight gain and quite a lot of misunderstanding around muscle building. And I think one of the things I wanted to raise on this webinar was the difference between bodybuilding and strength training, because that is, again, something I think that can really hold women back to building their strength, because they think of an Arnold Schwarzenegger type figure, and bodybuilding is a competitive, pretty complicated process, which is not going to come from picking up 5-10 kg dumbbells. And I think if I think about my mum, who's in her mid to late 60s, she does not feel confident walking into a mainstream gym, which kind of comes back to Rebecca's point about spaces being, truly inclusive and welcoming to all ages. And I think, unfortunately, my industry of fitness is still quite far behind on that front. I wanted to create a product that she could connect with in the privacy of her own home. So the majority of my community connect online so that they, have those interactions and that sense of motivation and support network, and they can ask me questions and connect with other women within the group, but also that they don't have to be forced perhaps into sort of environments and social contexts that they don't feel is representative of their needs.
That sort of, I think, relates, Marcus, I might bring you into sort of continuing on this theme of inequalities. Your work and your perspective, you're in the Indian context, and as you highlighted, it's a younger population, which relates to one of the questions from the audience about understanding life course and how, for example, things that happen at different phases of the life course have differential impact on later risk for ill health. So could you speak to this either from the perspective of working with the high performance athletes, working with younger people interested in aging, or also challenges that might emerge by working in more of a middle income country setting?
Yeah, I think the first reality that we face here is that diseases which used to be of older age are now happening at a younger and younger point. And I think some of the other panelists alluded to these points as well. A country like ours, 1.4 billion people, highly aspirational, being lifted out of poverty at such a rapid rate with a burgeoning middle class. We're adopting so much of the mistakes of the global north when it comes to choices around sedentary living, high calorific, high fructose, high carb food items, poor sleep, high stress, all of these things. So we're seeing, multiple comorbidities happening in people in their late teens, early 20s, which of course has a knock-on effect as people then age faster and have the different consequences that we've spoken about. Right? So I think that's a big challenge for us. And if I were to pick the top 3 aspects that we see medically, sorry, I know it's a bit noisy. The match is about to start. I'm literally courtside. If we pick the top 3 challenges, cardiometabolic syndrome is definitely number 1, particularly for us with our slightly poorer genomic anthropological choices and makeup. Problem number 2 is hormonal. Many young men now in their 20s with low T levels, women, Asian women undergo perimenopause 6, 7, 8, 9 years earlier than other parts of the world. So we're seeing big challenges around that. And we're also seeing, interestingly, a lot of autoimmune-driven clinical hypothyroidism, primarily Hashimoto's, which clinicians hadn't picked up on standard routine blood tests. So endocrine dysfunction is the second. And the third is non-specific inflammation, variety of causes. That in conjunction with some of the cardiometabolic risks cause a lot of challenges here. So these are some of the trends that we're seeing in the young population here.
And I think that's an interesting observation too, recognizing that as we're seeing development in certain parts of the world, we're seeing some of this adoption of these, what we now know are bad lifestyle practices that we've seen in America and stuff. So that's really interesting insights, I think. Rebecca, I want to turn to you to address another one of the topics that's emerged from the audience that may have and Fong tapped on it to it too, but the idea of ageism. In particular, part of my background is trying to understand better the role that ageism plays in the labor market experiences of older workers, particularly in that challenge of return to work that they often experience due to ageism. What perspective do you have on sort of how we might address ageism, but I suppose more, your knowledge about how ageism impacts the ability for aging well?
Thanks. Yeah, and it's interesting that we've all kind of touched on ageism in different ways as we've been talking here, whether it's about feeling that the gym is a space for me, whether it's about facing discrimination in the workplace. And again, when thinking about, how our behaviours impact how we might experience later life, we can often think, age is something which happens to someone else. Being older is like another group and isn't somehow connected to us. And I think that in part is ageism. I think we can think about ageism in a few different ways. So there can be that institutional ageism, so that which is it can be part of laws, can be part of policies and practices. Ageism is kind of a taboo. It's almost like, in some ways, it's one of those aspects of discrimination which people aren't talking about in the same way as they should be, because it does have a real impact. So institutional ageism will be the first one, and then that interpersonal ageism. So that can form, if someone sends you a birthday card and says it's all downhill from here. But it can also be accidental ageism. We become so used to it that we can perpetuate some of those discourses, which are really incredibly unhelpful. And then, of course, as has been mentioned before as well, that self-directed ageism. So after being exposed for it in so many ways, we can start to hold on to beliefs which are untrue and shaped by that. Like, I'm not going to do that strength class. It's not for me. That's for somebody else. I don't see myself here. I'm not going to go for that job. I'm going to, do this instead of that as a result of my age, when actually, those aren't true beliefs. They're stemmed from ageism. I think what it's really interesting to think about is that it can be seen as something which is harmless in ways, but actually there's more and more evidence that it has a real impact on people. It's very, very damaging, and that can show up in lots of different contexts. And one of them has been health. We spoke about this earlier, kind of people can go to the doctors sometimes with experiences of depression and anxiety, and they can be less likely to refer to talking therapies. There are some ways in which we're able to point to now that that can show this harm that ageism is causing. And actually this week there's a new campaign which is out. So you asked me, what might we do? And I would say that to support the Age Without Limits campaign would be one of those things. So encouraging people to learn more about it, to learn how to notice it, to learn how to challenge it. And that might be, you see a photo of some wrinkly hands in an advert. That's ageist. This is a photo which is being used to depict somebody. Use a photo of somebody. There are photos which exist there, but I would encourage people to find out more about the campaign, which is encouraging us to think about, what's aging and what's ageism, and to make that separation between the two. And in particular, be thinking about the intersectionality of this as well. Thinking about ageism in the context of people who've experienced lots of different types of discrimination, perhaps throughout their lives, and how age can intensify and amplify some of those effects as well.
And I think that's quite nicely relates to there's some work I know and slightly involved with in the past where really sort of unpicking the way that a lot of ageism, its source, or how it sort of gets really emerged, or how it emerges, is quite linked to ableism. So in many cases, it's not that people, fear being 80. It's not that the number of the age is what's there. It's this idea of becoming frail, or these negative stereotypes of older people. That's what people don't want to become. They don't want to lose independence and all of these things, which, the answer to that isn't stop getting older. It's, age well, maintain your health, do what you can to respond to your environment so that you don't find yourself fulfilling those negative stereotypes. Something that's related to that and has been coming up in the Q&A a couple of times, it's an interesting point I was hoping to make at some point, and I'm glad that it's arisen, is the role that nutrition plays. And I think of this, one of the ways I look at the question of nutrition and its role in aging well, I think often to understanding what are called commercial determinants of health, the idea that the food available to you in a given location is not, unlimited or infinite. It's built based on the sort of the structures, the culture, the economics of where you find yourself, and therefore that shapes the nutrition that you can take. Maybe I'll go to Nancy, because you're involved with motion and strength training and these kinds of things. To what degree do you pull in nutrition as part of a sort of your package, or helping people to age well?
Yeah, nutrition is huge, and there's all sorts of phrases, well-being is, 50% movement, 50% diet, etc. And, I definitely think that's true. You're right that there's a lot of factors involved in recommendations that are, related to an individual circumstance. It's very expensive to buy whole foods, particularly, I mean, there's going to be an international audience listening to this, but, in the UK, we know that, cost of food inflation is, higher than it has ever been. And again, going back to some of Marcus's points, lots of the most accessible foods are the least healthy, and that is a challenge for us as a society to overcome. I think, again, I mentioned earlier some sort of misunderstandings. Something that I do see a lot in my work is particularly women's fear or misunderstanding, perhaps, again, around protein consumption. Because I don't think necessarily there's been enough education for, developing that understanding of the role that protein needs to play, in maintaining your muscle mass, particularly as you age. So just, again, as a guideline for people who are listening, if this is helpful, broadly speaking, for every kilo of body weight, you want about 1.2 grams of protein. Okay, so it's just a helpful way to understand your volume. And I think it's something, it's still, we've got a long way to go as society until we, really understand and people are comfortable and familiar with what their macronutrient totals should be, on a daily basis.
And Fong, how does that come up in your work? Because I'm aware of when dealing with people who have dementia, for example, there can be big challenges in them being able to eat or recognizing when they're thirsty, for example. How does nutrition and that element of ensuring people are enabled to age well factor in your work?
I believe if we got the same principle, so that means we based on new digestion, but particular for older people, I think drinking water can be an issue. So the reason is because they drink and they need to go to toilet. So that is mobility that is also limited. So for example, if people in a community, when they work in a community, so we come to provide transport, and they call diet. So that means they collect about 10 to 15 older people on the bus, and they go around for 1.5 hours, and no one really feel comfortable to drink water because they cannot go to the toilet. And then also at home, and particularly like you said, they might forget, they don't feel thirsty. So we, when I work in the other research, it called social intervention, we do a program. For example, they encourage people to drink, and then they will mark down, and the carer mark down, today mom drink how many glasses of the carer. So that is, the thing we look at. Of course, we got some study like Mediterranean diet, so that is all healthy, vegetable and fish. Yeah, but I think Nancy touched it is diverse as well, the culture differences. So it's very difficult to change some of the diet if people don't believe it. So recently, I support someone have a cancer, and because a different culture, when you're talking about milk and yogurt, it's not on their menu, and that the way that all the protein are. So that thing is, we need more information, how we empower people. So that is, another area we look at empowering. Empowering is first of all being empower ourselves. So just go back this morning, I just said, when we finish the research, it have an impact, significant difference, we need to be implementing it. So here I have to really thank you for my supervisor, Professor Martin Oro and Professor Amy Spector. They really empower me to go to the community to do the intervention. And now my ICST training is globally, from America to Australia to Far East and Middle East, because like Brian said, it's not only here, we have to helping other, the whole global, to have a better, or we call aging well society globally.
Yeah. And Marcus, I mean, this topic seems very pertinent to the comments you last made around these issues with respect to cardiometabolic syndromes and other forms of inflammation playing this big role there in India. Do you have any perspective on how sort of this role that nutrition is playing and how it might be shaping people's individual perspectives or perceptions of what aging is in India, or when people become old, for example?
I mean, it's massive. I'm not sure it could be understated, the effect of what you put into your body. I try to use the narrative with my athletes and patients that it's about fuel. If you put the right fuel into your machine, the machine gives you an output. And you never go to a petrol pump and try and put diesel in your car. You never go to a petrol pump and try to restrict how much fuel you put in the tank. You understand a full tank lets you go that far. So we got to have a different conversation about food and fuel, etc. We're celebrating a lot of this convenience culture. Quick service delivery platforms, I'm sure they're equally prevalent across the world now, where sitting at your desk or on your sofa, you can get any amount of calories within 10 minutes. and business models are celebrated for that with a lot of venture capital funding behind it. I think it's got its convenience benefits, but it has a huge knock-on effect on our health, particularly for people who are time-starved, don't have the opportunity to cook at home, and of course, coming back home after a busy day's work. So there are a lot of these feeding in factors which are just affecting and making us pick poor fuel choices. Better education, better awareness. And as a young parent, my wife and I, we spend a lot of time with our kids. Even when we go into a supermarket, I actually encourage them to pick up a packet, to turn it around and look at the ingredients to try and understand at this age, what does an added sugar mean? What is a trans fat? How do you make smarter decisions around stuff that you buy? And if we can inculcate this at a younger and younger age, hopefully these are good practices and behaviors which will stay with us for a long time to come.
That leads nicely into the next point I wanted to make, which is I read a really interesting book talking about aging policy and health policy and how they, sort of defining them or thinking about them in various terms. And one of the insights I really got from that was that the authors made the point of saying we should stop talking about healthy behaviors and start talking about healthy practices. And the change in word may be subtle, but it emphasizes the idea that this isn't something that people just do in a moment, and maybe they do it again, and it is that these things become habits over time. And and especially when we're exposed to things as young children, that will shape how we respond. So, I mean, people will probably be aware of, children who were exposed to smoking at a young age are more likely to take up smoking themselves, for example. Well, that dynamic exists also when it comes to exercise, to eating well, alcohol consumption, sleep, all of these things that we understand as being part of good lifestyles to facilitate healthy aging. So I want to just open to any of the panelists who might have a comment about that or insights into how do we motivate, stimulate, support people to make these kind of changes in their lifestyle practices? Nancy, maybe I'll throw it to you, Nancy, because if people come to you and come to your business, then clearly they are motivated and they've got that motivation. But have do you have ideas or experiences related to stimulating that interest to begin with?
Absolutely. I think on exercise as a starting point, unfortunately, generally speaking, it is for weight loss outcomes. That's where people sort of enter their journey with exercise. And one of the things I love to tell people is that exercise actually changes the neuroplasticity of your brain and it helps you to adapt better to stress. And if you think about that and you pause and imagine there is, a way to move your body that is going to genuinely transform how you cope with life. It's not, going to fix everything, but it is there as a, powerful toolkit. It really helps people, I think, to think about exercise in quite a different framework. And that takes time. And we've talked a lot about habit building and there's a few great books which, are pretty classic now, but I'll mention them anyway. Atomic Habits is a classic, which I think really relates to the work I do, James Clear, around little and often actions that cumulatively have a really powerful impact. And something I'm really passionate about talking about is moving away from these sort of transformation type exercise programs, because I think they really sort of squash the progress that we are making as a society to get people to think about exercise in a really holistic way. And, that's why I don't offer anything that is, extreme in its nature. It's all about being accessible and consistent and, built for life, essentially.
And Rebecca, I'm wondering if any of your work with places may have tapped into the any of the evidence around creating, pedestrian-friendly zones. I'm, American-born, lived in the UK for many years now, and I'm based in London. My life is very walkable. I primarily walk, whereas in the US I would have to drive everywhere, and that's not even something I think about, but it has a big impact on my own mobility and my movement and stuff. So, Rebecca, do you have any knowledge about that space?
Yeah, I have interest. Don't quote me on the knowledge. I think I've got two kind of responses there, and thinking about a motivational piece, and one of them being place-based. But I think that, to come back to the point around ageism, I think there's a real role here for having more positive and realistic kind of depictions of people in later life enjoying and going about exercise. We need to change the narrative on it being a point in life to put your feet up and don't do too much. There's a lot that needs to be done there. And I think that also there's a piece around, with the leisure, with the industry. This is a great market that people have got here by being able to understand, okay, there are a lot more people who are growing older and are, want to be able to exercise and enjoy that. How can we work with people to understand what that might look like? How can we create a space which doesn't feel exclusionary, but instead people want to spend time in? And then thirdly, yeah, so place-based stuff and thinking about creating opportunities. Walkability is massive. If people don't want to go into town because there are broken pavements, that will have an impact on their, ability to feel comfortable moving around. Or they have to get 3 buses to go somewhere. Even getting a bus, there is a moment, there's a conversation around active travel. You have to walk to the bus stop, you have to walk from it. But if the bus isn't going to turn up, then you're not going to want to kind of venture out, especially in England, and the weather's like this. So thinking about all of those different ways, making parks attractive and enjoyable places to be. We know that green and blue spaces have a huge part to play in physical and mental well-being, but we need to be making sure that diverse ranges of older people are involved in conversations about making those the best places that they can be. There's loads of really exciting stuff that's happening. One of them is in Sunderland. They have the Wellbeing Project, which is a van that goes out to different areas where people perhaps might need or benefit from this approach more likely. They turn up with all the equipment, and then they have an exercise class in the street in Sunderland. There are some really amazing pockets of good work happening, and as you say, Frank, invest in that. We need to be responding to that and making sure it's easier for people to have good and active later lives.
And extending to that, Fong, there are a few points that people have made in the Q&A about your comments related to culture, asking about how do we perhaps stimulate better government approaches, or even societal attitudes towards appreciation for caregiving and the importance that social care plays in supporting the older people in our population. And in your work dealing with people who live with dementia and their carers, have you found any kind of interesting intervention or strategies to help people shift, some of their lifestyle practices toward a more healthy approach?
Thank you, Brian, and thank you for the question. Yes, it's very interesting. But before the cognitive stimulation therapy, we got a key principle from 18 key principles. But it's a round up. I think the first thing is a person-centered approach, because when people are vulnerable, they need to have their voice heard, to hear what is they needed. They need to be valued. Whatever, everyone is different. Everyone got unique need and belief, but we have to value them. We have to believe their belief. So that is really the motivation for you to engage someone and respect people choice as well. And also given choice, and it's how inappropriate. So that is a little bit learning here. If you just give someone so much choice for someone, maybe overwhelm them. But if you say a little choice is not leading to anything, but if you understand the need of them, you provide a wide range of choice, and they can make a decision. A person can make a decision they own it. So they empower them. And one thing I also would like to highlight is because for the last 5 years, I provide training to family care professional, from doctors, psychiatrists, nurses, and psychologists. And everyone come in and say, okay, we need to learn to how to improve cognition, but they forgot the carers is there as well. They are in the driving seat. They are support the people with dementia. If they don't have a quality of life, a better health, who look after them? So that is, I think the policy have to look into both. Don't forget carers. They have done a wonderful job and they need more support. We know that they have feel like burnout and stress and so many models to studying it, but their voice need to be heard. They need to support. The policy need to have them in there. So that is, I would like to express my passion for people with dementia, but also their carer. And of course, the society need to understand it better. A little help, it made a difference.
And I completely agree with your sort of call for better attention to the caregivers in the world. I mean, I think it's very poorly understood in sort of general society, the role that unpaid carers play in providing the care in a society. I mean, there are estimates, it's hard sometimes to estimate this, but there are estimates that of all the care given to older people in a given country, 80% or more is unpaid care. That is a lot of savings from the government, and it introduces multiple challenges, thinking, well, how do we modify the system? How do we improve the system? How do we, but you're right that without adequate attention to this, then you're potentially running into a future scenario where the caregiving makes the carers unhealthier, which then will make their carers unhealthier, and you become part of this unhealth cycle, or ill health cycle, I should say. We're coming close to the end, so if I'm trying to get through all of the questions as best I can, but if audience members have more questions, please put them in now. Before we end, though, actually, I'm going to come back again to you, Fong, to sort of to talk about the role that culture plays. In this context, I'm thinking about what could be learned from different cultural perspectives.
Yes, sorry, I missed out. That very important. Culture is really, because so many cultures now here in the UK, yeah, so don't think other, but if you under the culture, you understand their need. So everyone have a different approach. So I just said earlier, their belief is different with you, they're not crazy, because that is so my job before, I worked for the Vietnamese Mental Health Services. So my job, I went to hospital, train the professional, tell them if they do something like that, they're not crazy, but that is their culture. So we have to see what is called a culture sensitive. And then we provide information and resource. Changing someone's behavior is not easy. But if you acknowledge them and provide its information and resources as well, not only information. If you said, okay, here's the information, loads of them online this day, you have to find the one it meets your requirement. What is if you visit online for information, maybe go to like a government website and check some of the well-known organization. So make sure you get the correct, or I might say, appropriate information help you. And if not, always come back. You got GP there to help you. So culture sensitive, that is what, as a healthcare professional, we need to learn it. And learn it by talking to the service user and have their voice heard, and then we go from there.
Yeah, Nancy, come in. Yeah.
I just wanted to just make there's some brilliant comments in here. I don't know if people who watch this on replay will be able to read these comments. Sorry for my technological ignorance. But it's so heartening to hear all of these anecdotes around specific things that people are doing, walking football, park run, sort of local community-based activity. I think just a really important point that I want to make, which touches on what Marcus said earlier, is it's very easy in today's society to get a bit disheartened by the amount of public influencers, whether that's politicians, celebrities, etc., who perhaps don't always aren't the dream role models, I think, for us when we're having the thought about aging well. And it's so powerful to remember that each of us are an influencer within our own sphere. And it's so impactful for local communities to have real people doing these activities, whether that is in the privacy of their home or that is out and about in local communities, sharing it with their friends, calling up their friends, telling them about it, telling their grandchildren, all of those conversations are how I think society will really change over time. And it's just really exciting that there's so many people here who, are obviously influencing that behavior already. I just wanted to touch on that.
Yeah, no, that's a really good point. And I think it helps also bring us to the end here because we do have to bring it to a close. Um, and what I'd like to do is give each of the panelists an opportunity. First, I will apologize if we didn't get to address a specific question that was asked, but I do see some of the positive comments of the enriching nature of the conversation, so we've fulfilled that objective at least. But what I'd like to do, and perhaps I'll start with Rebecca, I'd like just to give each of the panelists a final opportunity to make final comments, and in doing so, I'd like you to perhaps offer to the audience an idea about something that you think is a big sort of a challenge or an opportunity related to aging, but something that you don't think we're really paying attention to enough yet, something that on the horizon, something we have to really focus on more for the future. So, Rebecca, please.
Thank you, and thank you so much for such a rich conversation. I look forward to rereading comments afterwards. So I've spoken a little bit before about the social determinants and how that's something that's been a thread through my work in the place-based approaches. I'm now working as part of a team in the Centre for Aging Better that focuses on work and access to work. So we know that financial security has a huge impact on our ability to be able to age well. We know that work can play a really strong part in physical and mental well-being if it's good work. But we also know that access to work is unequal. And there are lots of people in their 50s, 60s and beyond that would like to be in work that aren't. And so my kind of moment for the future is to share a little bit about what I'm working on at the moment as part of this context. So I work as part of a team that are thinking about employment practices and about employers as well. So if people are interested, I encourage them to look up the Age Friendly Employer Pledge. So to find out, is the organisation that you're working for now, thinking about age? There are things that are really, really simple, like flexible approaches to work, thinking about that lifelong learning piece. Are you being invested in, in your workplace? And I would encourage people to have a look at that. And what I'm interested in is a project which is supporting disabled older workers. So thinking about working with a group of lived experience of people with health conditions, with long-term health conditions, disabled people, and thinking about, okay, what might need to change in our employment support and practices, because something's not working at the moment. So my kind of look to the future would be around this in work and employment. And if people wanted to find out more, I'd encourage them to go to Centre for Aging Better's website. Thank you for this conversation.
Yeah, we'll definitely have to follow up because I'm working on that topic right now. So there will be interesting cross-fertilization, I'm sure. So Marcus, some final words, and what do you think is the thing we're not thinking about enough yet?
Sorry, data. I think in the last 3 years, and obviously this is happening at different rates in different parts of the world, explosion of wearable data, making a lot more insights on human biology and aging biology much more readily available, not just to the healthcare institute or the practitioner, but to the end user themselves. I think if we can, and that's obviously a big effort of what we're doing at Human Edge, which is around using digital intelligence to interpret data to make the correct lifestyle recommendations to people. A lot of information happening about LLM, ChatGPT, DeepSeek, all the stuff around artificial intelligence. I think if we can apply that to the health and the aging well setting, we can dramatically course correct, cut costs, and put ourselves on a better path forward.
Completely agree. Yeah, absolutely. I was hoping someone would mention AI. Fong, some last comments for you and what you think we need to focus on for the future.
It has been amazing discussion today, and we covered so many aspects of health and well-being with your impact on the aging well process. So I don't think I'm going to repeat myself, but I think we have to work, collaborate, and committed together, create the world that older people or people as we're getting older are valued, respected, and empowered through everyday activities, environment, individual needs, community, and the government. And of course, don't stop on research, because when we research, we find more solution and intervention. And we would like to create the world that is for aging well. So I think I stop here.
Yeah, so yeah, the important
for
role of
giving-
engaging communities, co-production, these kinds of things that are becoming more mainstream in the research world. Absolutely. And
Yeah,
I'm sorry, Nancy, last but not least.
So I think the thing that is worrying me, if I'm honest, is Ozempic and the ease of availability of that drug on the private market. I don't think we've seen enough data to really know the impact that that's going to have on all ages. And I think not only from a clinical perspective, but also from a societal point of view, it comes back to my point about people not learning long-term behavioral and lifestyle changes, you know, whatever age they are. That sort of quick fix mentality is something that really does concern me. And I think, unfortunately, is actually we know we're regressing on this kind of on this topic. So for me, to conclude, you know, love being part of this chat. I think if anybody listening to this is interested in learning more about strength training, particularly if you are a woman or you have a woman in your life who needs to get stronger, then do find me on ladies2crunch.co.uk. I'll put the link in the chat notes, and I would love to help and support with any of those questions you might have off the back of this. And thank you, Dr. Brian Beach, for having me.
Well, and I think you know, your point raising the, you know, potential concerns about something like Ozempic and these semaglutides, you know, it relates to your earlier point really about recognizing that exercise is about sort of physical conditioning rather than just weight loss. And, you know, I think you're raising an important question of, you know, if people are just using these medicines to lose weight, that may not actually have the long-term benefits for their cardiovascular health that we anticipate, because we've seen associations with obesity and poorer health and from other studies in the past. So yes, with that, I will conclude. I don't know, Lisa, if you wanted to say anything finally to sum up the event. But I certainly want to thank all of the panelists for their excellent contributions and participation. Really enriched and varied discussion.
Thank you, Brian. Yeah, I echo all of that. Absolutely enjoyed every moment of this session. There's so much in there, and I'm really looking forward to actually watching the recording back so I can take some more notes. But yeah, thank you very much to all of you for giving your time. I also just want to say a huge thank you to everybody who has tuned in to join this session today. It's been really lovely watching the chat and seeing how everybody's enthusiasm around this topic, and also just sort of sharing your connections to UCL as well, just from every aspect. It's been really, really enjoyable. I just want to say it's really helpful to get feedback on these events so we can improve them for future. if you wouldn't mind, if you have a few minutes, it's a very short survey, you can find the QR code on your screen. But also I will be sending an email as well later, very soon. So I'll also include the link in there for you. So all that leaves me to do really is just to say a huge thank you to everybody once again. And I hope you have a wonderful rest of the day. Thank you so much.